welcome back to the Athlete Spine today. Phil and Vanu here. We're just hopping on for a quick video because there's been so much news about Mike Trout recently. He's been out for a couple weeks now, had to miss the All-Star game because what we thought would have been, lumbar back spasms or strain, but new information's come out.
Yeah, so it sounds like Mike Trout was diagnosed with a costovertebral joint dysfunction as the supposed cause of his symptoms. And what is that? So costo means ribs and vertebrae means spine. And so this is basically a dysfunction of where the rib comes and meets the spine. And while this condition is not very well understood, it can cause symptoms of back pain, difficulty with movement, and all the things that you would expect would make it difficult for him to play baseball.
Yeah, and if we think about all the activities he's trying to perform right now, we can understand why it hurts. It's just a hard diagnosis to make because we don't see it very often. But we did hear that he had a cortisone injection recently. What exactly does that mean, and why does it help?
Yeah, so cortisone is commonly used to treat inflammation. It's basically a steroid injected into various parts of the body, and the idea is that it reduces inflammation, reduces swelling, and hopefully it helps people recover faster. We're not exactly sure where Mike Trout received his injection. It'd be pretty hard to actually access the T5 costovertebral joint, which is where it's been reported that he's had a problem because the costovertebral joint is very deep and it's surrounded by the lung, it's surrounded by your spinal cord, and so actually getting a needle into that spot would be pretty difficult. What he may have had is what's called a trigger point injection, which is also a steroid injection or a cortisone injection, but it's given more in the soft tissues and the muscles around the areas that may be spasming because of the costovertebral joint dysfunction. Hopefully that's going to help him recover and get back to play faster.
Yeah, and oftentimes with these cortisone injections, right, just like the reports have shown recently, is that it can take up to a couple weeks to experience sort of the initial full benefit of what that anti-inflammatory effect will provide. So yeah, he may not notice a huge improvement for a while, but we remain optimistic as he does, and that he'll be able to get over this. And it sort of remains a day-to-day sort of injury, and one that almost never requires surgery. So our best wishes are out to Mike Trout, and hopefully he gets back on the field soon. So thanks again for joining in. Don't forget to like and subscribe and follow us on Instagram at The Athlete Spine.
Take care, everyone.